a production of the Mesa Chamber of Commerce. Visit us at mesachamber.org.
Every 40 seconds, we lose someone to suicide. That's over 2,000 people a day. So a lot of you might have heard that there's suicide is the silent epidemic. Has anyone ever heard that before? Yeah, it absolutely is. You've heard about the opioid crisis and things like that, also very important. In reality, it's affecting so many people that it's really hard to keep up with. And COVID has really just made a lot of these things really exacerbated. So one reason why we got invited to talk here today is because we do a lot of community education this way. And this is a big month for us as a hospital because it's one of the biggest months that we get to go out in the community and talk about what we do because it's Suicide Prevention Awareness Month. But in addition to that, it's also Recovery Month. And so Recovery Month, does anyone know what that is? Just out of curiosity, I love audience participation. No? So Recovery Month was established to celebrate folks that are in long-term recovery, more traditionally for substance use disorders. And so someone who has been going to AA meetings, or maybe they have different support systems or therapeutic support systems, someone who is in recovery, usually after a year, that person's considered to be in long-term recovery. And when we really talk about that celebration, folks that are in for recovery and just addiction treatment in general, a lot of the times, guys, that's a daily battle. With substance use specifically, really, there's physiological changes that happen to your body that it's not so much about I went down a street that made me reminded my triggers or things like that. There's physical things in your body that can impact you wanting to utilize a substance that are in there. So within that, just out of curiosity, I want to take a little poll here. If we had to say one in how many people are impacted by something relating to their mental health or substance use in a given day, one in how many people do you think are affected by that prior to COVID? Depression.
I got 1 in 5.
You got 1 in 5.
1 in 5 from David Hughes.
David Hughes, you are correct. 1 in 5 people are impacted in some way that it impacts their day in a way that is overtly stressful. So one thing I like to do is just say 1 in 5 is not a lot. There are 1, 2, 3, 4, 5, 6. There are 6 people in this room. Odds are against us, guys. Now, here's the deal. I go out to a lot of, we've been at school events all month and things like that. I love sharing this kind of thing with teenagers because, again, we're just starting that conversation. But it's not uncommon for teenagers to come up to us and, we'll like, okay, one in how many people do mental health trivia? And they go, I don't know, like 100. And you go, okay, so you turn around, you see, you're at the lunch courtyard behind you, and you say, okay, so 100 people here, it's 20. 20 of the people behind us here today. And so, say 1 in 5, there's 5, jocks kind of walking up and they instantly go, oh, it's you, Brad. And, that sort of thing, right? So mental health challenges are more prevalent than we think about, but it's not something that we easily talk about. Why is it so hard for us to talk about mental health? What are your guys' thoughts on that?
Stigmas that may be associated with mental health.
Yeah, people differently, right?
Yep. Embarrassment. People get embarrassed.
Embarrassed. Maybe, we hear a lot of things that people might think that you're weak. Not strong, right? Who's ever seen the mantra that says, check on your strong friends? The thing too. Now, here's the deal, guys, with mental health. Now, what I'm trying to do here today, I can tell you all about what we do at the hospital. I'll share some of that here as we wrap up and towards the end. But in all reality, I just want to help educate folks on how things get to that crisis point, because it's something that we don't talk about enough in society. Now, the idea here is this isn't an overnight thing. If you look at suicide statistics, a person who dies by suicide typically has been experiencing some of these challenges like anxiety and depression for a very long time. But things have been manageable for a certain amount of time. I know sometimes in movies and things like that, and there's certain situations, and I don't mean to be insensitive to any situations that are there, but you hear about situations where someone chooses to take their life after a very dramatic thing happens in their lifetime. Maybe they lose a significant other. It could be that job loss. How do I support my family? Things like that. You hear about these types of things, but the reality is that person's been struggling with these things usually for a lot longer. It's a very small percentage of the time that things are different than that. So what I'd like to educate everybody here on with this is how to look out for the small signs of things. So within that, let's take just depression and anxiety. there's a good chance that you face depressive symptoms on a daily basis sometimes, minor, small. We go through different things in our life. Example, you have a bad breakup, something like that, that can put you in a spin for a little while. However, I'm going to use a little analogy for us today. Who here likes to cook? Anybody? Who likes to make someone in their life cook for them? Just kidding, I don't like that, but just keeping you guys in here. So I prefer to cook. My wife now wants to take that away from me. She's found the joy in it. And I'm a cleaner cook. I would much prefer to manage that. But a big part of this is I like to look at mental health in a way like you're trying to manage your kitchen, right? Especially you're trying to make a big meal. You got that stove there. You're like, I got 4 burners here. I can make some stuff. I got extra room in the oven. But when you're cooking, you really have to manage your time well. You have to manage everything that you're doing. Because if not, what happens if you stop paying attention to stuff you're cooking? It gets burned, it boils over, you get that big pot of water and all of a sudden there's a big mess there. All kinds of stuff can just happen really quickly and get overwhelming really fast. Now, let's say you're cooking and all of a sudden, woof, all right, one of these pots, you're boiling some potatoes, boom, boils over, you got a mess in your hands. But you still have things on all the other burners, you still have other stuff you're doing, you're trying to chop a salad, you're trying to get everything else going. So what do? Do you immediately try and help that situation where it boiled over? What are your guys' thoughts? All right, seeing some yeses. Who's like, nope, damage is done, let it burn. It's okay if you feel that way. Here's the deal. It's kind of a double-edged sword. Sometimes we don't know what to do in that situation because if we choose to then tend to that exact situation right there, we're now not paying attention to other things. And when we stop paying attention to other things, realistically, we're going to see more things start to boil over. And here's the deal, guys. This is exactly what happens in our life. We have stressful situations that can creep up on us. Sometimes they're things we see coming. Sometimes it's whatever life throws at us. In reality, COVID threw a lot at a lot of people. And that's why we're really seeing mental health come to the brink. If you want to see people change completely in how they act and how they interact and how they take care of themselves, throw a global pandemic around. Because when you can't go out, when you're not socializing, if you guys remember those early weeks, nobody went out. You'd go to the grocery store, there's 10 people inside of it maybe, right? You were very minimal about it. Impacting people's life like that, it throws a lot of curveballs. And so we don't know how to manage those types of stress. So no matter what your stress is or what you encounter in life, I just want you to think about this from that perspective, that mental health challenges, what we're seeing, folks that come to our hospital, it's not, we hear a lot of like the, ooh, those people, or, I hate it, but we hear a lot of like, oh, crazy people, or this or that, right? People that come to our hospital are every single one of us here. And the truth is, what we've done is we've been trying to manage things on our own. We've been trying our best. We're trying to not let those pots boil over, but it's become overwhelming. We can no longer manage all of those things at once here. And so when that happens, that's when the crisis happens. Now the house is on fire. So instead, there's a lot of different things you can do to help manage those things and seek services before things get to a crisis point. For managing your mental health, what do you guys think a good step 1 would be? Things are getting stressful, thinking about maybe therapy or something. Do you guys know what step 1 looks like?
Acknowledge it.
Acknowledge it. Yeah, I love that. Acknowledge that, okay, usually I'm pretty good at managing some things. Right now, I'm kind of losing my marbles. I am not feeling good. I am feeling different. Little things like that. It's acknowledgement. Second, though, a lot of times, and I like to just break this down for folks, it's not that you need to necessarily go from, I just don't feel okay, to now I'm going to be going to an inpatient program and spend 10 days at a hospital, right? There's a lot that happens in between that. But the truth is, we don't talk about when we don't feel good like that. We have a hard time acknowledging that, even to our closest friends and family members, a lot of time because of that stigma. And so the reason we see people get to that crisis who have never had any kind of therapy before, which happens more than you'd think, it's because that now snowballs, right? That overflowing feeling, that overwhelmed feeling, it snowballs and snowballs and snowballs until now we're in crisis. We've been actively thinking about suicide for a while, but we haven't had the courage to talk about it yet. And there's so many reasons that can go behind that. But what I would encourage you guys is check in with your family members, educate them as well. It's Suicide Awareness Month. Do whatever you can, whether it's sharing things on social media, if it's part of your business, show that you are pro mental health and share something that's relating to Suicide Prevention Month to build awareness of what it is and just encouraging folks to take care of their mental health before things get to that crisis point. There's so many things that can be effective. And in all reality, if someone does go to the hospital, 9 out of 10 people that go to a behavioral health hospital for basically suicide prevention for an incident, 9 out of 10 people will never attempt suicide again. Recovery is very possible. It's a big thing to talk about here. But within that, guys, also learn that there's different levels for those things. So for example, our hospital, and I'll wrap up here, is a lot of times people just know us for the inpatient side of things, but we actually provide every level of care. So a lot of times, first step for folks is maybe trying things like medication, right? Medication can absolutely help with things like anxiety and depression, but they also will probably go to individual therapy. So individual therapy is great. A lot of times people will go for, either weekly, they'll do it twice a week, they'll do it once a month. It's really what that person's individual needs are. And there's a lot of way to get that. You can use resources like Psychology Today. There's now apps like Talkspace and BetterHelp and things like that. And then if you get to a point where you go, you know what, individual therapy is helping, but it's just not quite enough. I think I need a little more. Again, it doesn't mean hospitalization. At that point, you might want to consider, and this is something we offer, is an intensive outpatient program. And so what that looks like, that's for adolescents, that's for adults, it's for everybody. Usually you can find these programs not just at our hospital. There's probably 60 places that do this in the Valley. A lot of them are going to take your insurance. They're going to take the state access, Medicaid plans, Medicare, things like that. But what you do is for 3 days a week, you go in and you do group therapy with up to 10 people, 3 days a week for 3 hours per session. Now you attend that for about 6 to 8 weeks. A person can do that while still going to individual therapy. We would call that the next level of care for that. So it's a great way to help prevent things from going further to needing a hospitalization, but it's also a great program if someone is going into the hospital. The idea of coming back home, whether there might be triggers at home, right? The idea of going right back into your work life, your home life, your family life, the commitments that go into those, that can seem pretty overwhelming as well. Being able to step down into an outpatient program and have that therapeutic support as you readjust is a really big thing. So we offer that. And then in addition to that, there's even a step up before inpatient. That's called partial hospitalization. That's where someone will go into an outpatient center and they will go to basically the day treatment of programming for 5 to 6 hours for about 2 weeks. And so it's not uncommon for, again, I encourage you as you have conversations with staff members about mental health or at your organization, there's so many options that are there to help out staff members, to help out their children, whoever it could be, that don't necessarily have to require that hospitalization. So they would go for 6 hours a day though for 2 weeks. And again, great step down option, or it's a great prevention option for hospitals as well. But that being said, we do have 230 psychiatric beds at both of our hospitals. We have a 24/7 admissions line. I really encourage you guys more than anything else. I come from a clinical realm. I'm not traditionally a marketing person. I worked with kids in crisis up to 24/7 in their homes prior to coming to Aurora. And the biggest thing I can tell you guys is that if you have a family member who says, I'm not doing well, or someone you care about, they have that conversation with you and they go, I've really been struggling lately. I want you guys to take that seriously. There's a whole lot of different resources that are here. I'm going to be sending some along so we can share with the group. I have some here in person, but in all reality, seek professional help. There's a lot of different helplines that are completely free. You can go through an assessment, but I've heard so many different times and so many just tragic stories where family members have shared with me at different trade show events and things like that, that, I knew something was going on, I kind of asked and they said, no, like I'm okay, it's fine. And, they tried to downplay things. And unfortunately, they've lost somebody to suicide that way. So I really would encourage you guys, have a conversation openly with the people in your life. If it's something you're comfortable with, tell them, say, I'm a safe person, not me, you. I'm a safe person to talk to about mental health. I want to support you in any way that I can. I'm not an expert in it, but we'll get you the help that we need to for it. So I don't want to take up too much time here, but I just wanted to share a little bit about mental health. And I also would love to answer any questions that anybody might have.
Does anybody have questions for Jordan? Okay, well, Jordan, thank you so much. Really appreciate it. So thank you.
Perfect. Well, thank you guys so much.
And I will be sure and send out information to the group here as well. Is Chris Powell on the call? Is Chris still on?
He's out there somewhere.
I'm here. Sorry about that.
There.
So really want to just have Chris take a few minutes and speak, but also I'd be remiss to not say that we celebrated Move 1 Million today. So all of our staff here at the Mesa Chamber wore our Move 1 Million t-shirts. So anyway, Chris,
I
take it
love it. Well, thank you so much for representing for Move 1 Million. And for those of you who don't know what Move 1 Million is, so we are we're a nonprofit, and with the sole mission of bringing movement and mindfulness originally to schools, but now it's also grown into the foundation of senior living, Dignity Health Hospitals, Phoenix Children's Hospital, et cetera. So we are it's 2.5 minutes of movement followed by 2 minutes of mindfulness. And we grew very quickly in the Mesa Public Schools district. And now we're going to be serving the entire city of Goodyear. We're moving into the Roosevelt School District next weekend. We're in talks with Cartwright School District. And so again, this whole thing's really starting to take off. In fact, the state of Florida heard about what we're doing. And so now they're flying me out to Florida in October to be the keynote speaker at what's called the SHAPE conference. And it's the conference for all public school PE teachers across the entire state to come to in Orlando to present this to them so that the state of Florida can now adopt Move 1 Million with the goal of moving at least 1 million people every single day. And it started as a service project during COVID. And I just saw that we're more sedentary than ever. And actually going back to the presentation that we just saw, the numbers of anxiety and depression and suicide were through the roof. And so I was thinking, what could I possibly do to help serve all these people that are suffering? And that was the inspiration behind Move 1 Million. And so now here we are. We've got I ended up building app technology around it, and there's also a simple 30-second registration process where you can register it, and then it gets emailed whenever you choose. You get the daily broadcast emailed to your organization every single day, so that you can use it for your own internal broadcast. And so now we can move corporations and schools and hospitals, and so it's moving really fast. In fact, so we just opened up our doors 5.5 months ago, and we're moving 76,000 people a day now, and the numbers keep going up. So it's been a lot of fun. So thank you for representing Move 1 Million. And as a fellow Mesa native, I was born here, not quite raised, but I've been back for 24 years. It's definitely an honor to be a part of this board and to connect with all of you. And really to represent Mesa as we grow nationally and internationally.
Chris, thanks so much. Anyone have any questions for Chris? And Chris, could you put your information in the chat?
Yeah, absolutely. Absolutely.
Great. So, well, I thought what we could do now is there's a few people who had showed up after our initial introduction. So I will go ahead and have folks introduce themselves here. So Denise, do you want?
Hi, I'm Denise Carter with Overflow Visions.
Okay.
Hello, my name is Amy Fatwafe. I'm with Native American Fatherhood and Family Association.
Thank you. Anybody else on Zoom that we might have missed, Bob?
No, but I think we should get updates from Lee and Mark Young.
Yes, yes, and others as well. So, hey, take it away, Lee.
So we have an exciting event coming up that the Congressman is putting on. It's a senior citizen resource fair. And the date is Wednesday, October 6th. And it runs from 10 a.m. to 12 noon. And it's going to be at the Love of Christ Lutheran Church on Power Road.
Could you put that information in the chat as well, Lee?
Oh, you bet.
Thank you so much.
That's
And
it for
Mark,
me.
that's it for you? Okay. Mark, could you give us some updates, please?
Sure, I don't want to steal any thunder. So we're celebrating our 100th anniversary this year. So we have a lot of events coming up. Our next one is, our first one actually, is a top golf tournament on September 23rd. We'd love to have you be a part of that. We got some cool stuff going on. So if you'd like to do that, that's great. The work that, and you all know this, the work in our community is continuing to expand, will continue to expand. And so we need to rely on each other to make sure that the most vulnerable people in our communities are being served. So that's enough of me. Thank you.
Thanks, Mark. Dave Richens, hello. Hi, can you give an update of what's going on at United Food Bank?
Sure. Gosh, just dive right in, I guess. So we're seeing our month over month demand for food up about 13% right now. We think that's probably related to two things: a little bit of seasonal increase when we have some seniors coming back into town for the winter, and then the end of some of the unemployment assistance and rental assistance payments that have been going to a lot of those folks. So a little bit of increase. We're continuing to monitor that month over month with each of our agencies. We are well prepared for anything that the pandemic may be bringing our way. We are stocked to the gills with food. We have probably more food in this warehouse than we've ever had in our history, and it's kind of getting a little crazy. So we are actually currently negotiating for a little bit more space to be able to do some more innovative programs. I've talked to some of you about those. We may be making the rounds with some more of you to talk about those programs to see how they end up looking. But things are well, our trucks are rolling, and our agencies are still receiving food, and just we're handling that increase just fine. So,
Thanks, Dave.
you bet. Thank you.
I'd like to open it up to others that are on the call. Kayla, anyone who had some announcements that they'd like to make, would love to hear from you. So I know that you have an event coming up, Kayla. So if you'd like to share that, that would be great.
Sure. I'm not sure. Are you talking about our game night? Is that what you're talking about? And that's coming up next Thursday, a week from Thursday. So we're going to do it. We're going to do it safely, but we are still selling tickets for that, and that's going to be a lot of fun. It'll be interactive games, kind of like Jeopardy and things like that. So it'll be fun. And then we just start doing what we do. We have a waiting list always, and it never ends, it seems like. And the needs are always great. We had a big event last Saturday where we reopened our donation center and renamed it the Helping Hands House. And we are trying to stuff the truck, and we have a big, huge truck. And what we get so many donations, and we are so blessed to overflow that we share with, places like Sunshine Acres, Panda Vida, things like that. So we had a really great turnout for that. So that's about it.
Have you guys opened a facility for single men?
No, we have not. We're still just families.
Okay, I thought that was true. I want you to know that 211 gives out your number when you are looking for housing for single men.
Well, isn't that interesting? Okay.
Yeah.
Yeah, no, that's not us.
I told them that, and I said, unless something's changed, I'm sure that's not true.
Yeah, no, that is not true.
Okay.
I'll check on that. Thank you.
Yep.
Hey, is there anyone else that has updates that they'd like to share?
Yes. So Lisa Olson here from East Valley Children's Theater. This is our silver anniversary. We're celebrating 25 years in the East Valley, and we're very excited about it. Our first show of the season takes the stage September 23rd. And it runs through October 3rd at the Mesa Arts Center. And it's called The Clumsy Princess. It's another world premiere. We're known for that. And we have our first little fundraising event happening on Saturday night. It's a Bonkers for Bunko night from 6:30 to 9. And people can go to our website, evct.org, and visit the store to purchase their $25 ticket to come to our event on Saturday. Ticket sales to our main stage productions are just $15. That's it.
Awesome. Thank you.
Thank you.
Anyone else? Marlo, do you have anything?
No, no, I mean, everything in Mesa schools is we're just going strong, trying to support kids and families. And Chris has been active, hitting the schools, getting kids doing Move 1 Million, which we're hearing a lot of great feedback about kids feeling good and focused. And it's like the best part of their day. So we're just trying to expand that. But, you know, and many of you are involved in all kinds of stuff with our school. So I know we appreciate it, but nothing of urgent matter to really share at this time.
Thank you. Anyone else? Denise, do you have anything? Okay. Anybody, go ahead.
Yeah,
please.
we're, I'm brand new to this, so I haven't met a lot of you. But our organization, we work with families throughout the country that really focus on how do we strengthen families by promoting responsible fathers and mothers. And so we'll be having our 17th annual Fatherhood as Leadership Conference coming up here in Mesa at the Doubletree Hilton across from the old Fiesta Mall. And that'll be November 2nd through the 4th. And you can register for that at our website, which is nativeamericanfathers.org. You do not have to be Native American to attend, but our whole focus is on strengthening families. So we'd love to have some Mesa reps there as well. So.
Thank you. Okay, Dave Hughes, anything going on at the Med Center? How are things? Are you guys at capacity? How are things?
You know, I wish I could say it's raining men, but it's not the case. We are not at capacity. We're working to get there. It's been a lot of guys coming in, checking out with time expired, which means they're taking advantage of the services and staying the whole 120 days. But it's not, they're not knocking down the door like we were hoping once all this unemployment and stimulus stuff starts calming down. But we're still anticipating. I was also looking, and I believe it's Casa de Amor. I got a message. They were asking for outreaching for help for their clothing closet, men's clothes and stuff like that. So if you have any connection with Casa de Amor, if you could reach out and help, I'm going to look and see what we can do. So just FYI with that. Thank you.
Welcome. I did want to, there is a couple of announcements that through the chamber. For those of you who were on the call last month, we talked about the giving catalog that we do for the holidays. And we are preparing for getting that giving catalog out and ready. So I will be sending the form out to you, which is a fillable form. And we do ask that you fill it out and send it back. This is something that we share with all of our members that was quite popular last year. And so it gives you the opportunity of sharing what your needs are and what your wishes are. And folks, as you know, are very generous during the holidays. And so would love for you to participate in that catalog. And the other thing is I would highly encourage you to check out our website and check out our events. We continue to, have some great events and would love to have you attend. So I won't go through them, but check out our website. So Bob, do you have anything? So we are ending the meeting a little bit early. If no one else has anything to share. Going once.
Hey,
Okay.
can I give a shout out to Nadia? Is that all right?
Yeah.
So Nadia is on Mesa United Way staff, and this summer she organized vaccine clinics at several of our elementary and junior highs, and she's been a trooper. She's done a tremendous job helping out low income families. And we have a great partnership with Best RX. So I'm going to give a little shout to them. They're a new pharmacy on University and Mesa Drive who've been at every one of these, have administered the vaccine at every one of these, and has done it at no cost. So Nadia, thank you for that. And if you haven't visited Best RX, give them a shot. Okay.
Thank you, Mark.
Yeah, I've been keeping tabs on the Facebook page, and I was just curious, can we get Alice Cooper at one of these meetings? Is that where Sally is, out hanging out with Alice Cooper?
You never know, so I can certainly, share this with Sally and see what we can do. So anyway, I did want to share with you that next month we will have a speaker from Maricopa County. It was brought up at last month's meeting that folks were interested in the ARP funds through Maricopa County, and so there will be a representative that will be speaking about those funds and how they're being dispersed. So hope you can make it then. And I just want to say a big thanks to all of you, each and every one of you, for the great work that you do, and you just keep doing it. So thank you so much. And I want to say have a great day and thank you for attending the meeting.
Stay connected to Mesa Chamber social media, email newsletters, Monday morning message, and mesachamber.org to always know what's happening at your Mesa Chamber.